Okay, Joshua, thank you for joining us tonight, and I now give it over to you.
All righty, everyone. So thank you for showing up tonight. As Maureen and I were discussing before the meeting, it is a beautiful day outside, so it's welcome that you guys are here, and hopefully you can learn something. So today I wanted to talk about the medical assistance loophole. It's known as the PH95, but it's really a stopgap that allows parents that have children with disabilities that you're not necessarily subject to employer coverage or any coverage really with high deductibles, that you can get access to care that's it's affordable and it's manageable. And really today the hope is that we could talk through what the PH95 is, what the coverage is, and then there's some life events that I do want to address regarding having a child, or potentially especially if you're a parent with a dependent who is nearing adulthood and has been a lifelong someone with a disability for their whole life. We want to make sure that you have some assurances, some comfort as to the process moving into adulthood. So at the end, I will I do want to also bring up there's a Medicaid unwinding that people are about to start dealing with starting in April. So at the end, I will address that briefly. I did not make slides for it, but it is something that I think is going to be topical for anyone on this call that already has medical assistance for their dependent. And I will be here for any questions. If the questions that you have, because this is medical related, if it's something personal that you don't feel comfortable bringing up at the end of the call, then I will give Maureen, you have complete authority to send my email out to those people. You can just reach out to Maureen, and then she'll put you in contact with our team, and we're happy to answer any personal questions that you may have. So before we get too far, I do have to do a little bit of housekeeping. Everything that we're talking about today related to Medicaid is a state-by-state difference. So we are talking specifically about Pennsylvania. My team's based in Lancaster, but we do have clients in 13 states. So the topics that we're going to bring up are specifically related to the Medicaid waivers and the eligibility in the state of Pennsylvania. And then we are a 501c3 nonprofit in the county of Lancaster. We assist people with Compass and the process of apply all the way to approval when it comes to any county assistance office in the area. Currently, we have clients specifically when it comes to Medicaid and the county assistance from York County up to Dauphin, over to Berks, and obviously Lancaster as well. So,
Joshua, I had a question. Is this going to pertain just to young children, or would adults also be?
So today's talk is going to be about the beginning. The majority of it's going to be about people that are under the age of 18. The aging into adulthood will reference programs that are available for adult dependents with disabilities. So it will address adult children at that point, but the majority of the talking will be for related to dependents under the age of 18. So just a quick plug, if you need anything and you go to our website, it's helpinghealth.org. Just a personal story about why we do what we do. I am a financial advisor by trade. I was a financial planner for a number of years. My son was born at Women's and Babies here in Lancaster. Great hospital, but we were double billed for that event. And for the last 10 years, we created a nonprofit, which is Helping Health, and a benefit corporation to help people navigate the whole spectrum of insurance and getting access to the benefits they're eligible for. So again, like I said, we're going to talk about the PH95 loophole, what benefits are actually available when you do become eligible for Medicaid, how to coordinate with other coverage, and then, as I mentioned, those 2 life events of both technically aging into Medicaid by being born and then aging out of the PH95 or the child waiver for disability. Excuse me. So just at a very high level, if we go back to what I was saying earlier about being that stop, that backstop for consumers, most individuals and families understand that you can get insurance through an employer, you can get it through Penny in Pennsylvania or healthcare.gov in other states. You have access to Medicare if you're over 65, Medicaid if you are low income or qualify because you're either aged, blind, or disabled. And that last one is really what we're talking about here. So Medicaid and the PH95 is just a category of, the PH95 is just a category for Medicaid to assist people with special needs. Medicaid is often thought of as the benefit that gives you health insurance, especially if you're low income. The reality is it's a lot of things wrapped up into the same word. The category is really what dictates what you get and how you get services. Medicaid, when you are low income, it's often the 0 premium solution to be able to see your providers. When you are disabled and can apply under the PH95, it gives you access to the same providers at an affordable rate for what you pay out of pocket. But Medicaid could also be for seniors that have to rely on a government program to cover long-term care if they don't have assets to support going into a nursing home or something like that. So as far as the PH95 is concerned, we are talking about children under the age of 18, which are children, but 17 and younger. They must meet the Social Security disability standards, and I'll get to that in a minute. And you do have to report your household income. Now, if you're eligible based upon a disability, they're not going to count that income to determine whether or not you're eligible, but you do have to report it. And that last piece is what I'm going to talk about at the end when it comes to the unwinding, which is in order to be eligible, there are ongoing commitments that as a parent you have to do. So when we're talking about the Social Security standards, there are a number of different definitions as to what a disability encompasses. It could be low birth weight if someone was born premature. It could be autism. It could be some other mental or nervous disorder. It could be musculoskeletal. All of those standards, if you notice on any of my slides, at the bottom, if it's too long of a URL, I've shortened it with a bit.ly, but the direct link to these standards and what is and is not considered a disability, any of the slides that were on that have sources, that's going to take you directly to the Social Security Administration website so that you can continue to get the care you need, because that and the reporting part, you can't help your child aging, right? You can't control them being 18, but fitting within the parameter of a disability and reporting your income are two things that you have control over as far as tracking and maintaining that framework. So as far as a disability is concerned, what I will say is that this is not being disabled does not mean applying for any type of Social Security benefits or anything like that. It is purely tied to whether or not the Social Security Administration would deem your child to be disabled. So you don't have to apply for anything. You just need to fit within those parameters when you're dealing with your caseworker. That's really what you're reporting. So as far as applying is concerned, again, you can do that right through Compass online, by phone. They do have a resource for mailing in an application. I put the County Assistance Office as a source of last resort. Really, the success that we have seen in not only getting Medicaid, but renewing your eligibility comes down to the statewide customer service line. Generally speaking, in any county in the state of Pennsylvania, they're understaffed. And on top of that, before COVID, we had 1 million people out of the 12 million people in the US, or in the state of Pennsylvania, 1 million people were eligible for Medicaid or CHIP. Today, we're at 3 million of the 12 million people. So that's 1 in 4 individuals in the Medicaid and CHIP systems, and they're still understaffed. So oftentimes calling the statewide customer service line, you can get a hold of someone right away. They can tell you what's going on with your case. They can often make notes on the system and put a requirement that the caseworker get back to you within 3 business days. And if they don't get back to you, you can make another call, and that gets escalated to a supervisor that actually gets your case looked at. Calling the local number, if anyone has done that here, you go in circles. It's a prompt that never actually gets you to a person. So oftentimes we say the statewide system is the best way to go about trying to get a hold of a person if you're trying to get a hold of somebody. So as far as benefits are concerned, the big 3 are, if your dependent's eligible for Medicaid, it is 0 premium, 0 deductible, and 0 coinsurance. And that doesn't depend on your income, right? Like I said, you have to report it, but they can't count it. So at the end of the day, that stability in and of itself is the crux of the PH95, is saying, if I need care, I don't have to worry, what am I going to pay out of pocket? There's no premium on a monthly basis. And it could very well be that you have a household of 4 or 5 where only one dependent is PH95 eligible and the rest are on a family plan. But as far as the dependent that could very well, especially with a disability, have higher out-of-pocket costs traditionally, having no premium and having no deductible and having access to care without worrying about those things is crucial. So I did want to put in here, this is an example of, outside of those 3 zeros, what a typical plan would cover in the event you need care. So an ambulance, we all know those are not cheap. So a $0 copay for an ambulance visit, a $3 copay to go to an ambulatory surgical center, no cost for medical equipment, $1 x-rays, $1 and $3 prescriptions, and the most expensive thing on this list is a $3 per day rate to be in a hospital. So if we're talking about a dependent that is admitted to a health system for 7 days or more, the total outlay would be $21, which is nowhere near what the actual cost of care would be in that case. The other thing that I will say is when you get into the system, Medicaid it's not a government system. Like it's not government insurance. It's not like the 1940s or 30s where we're talking about government cheese. The state of Pennsylvania determines eligibility, but after eligibility is determined, that they see we have, they fit within a guideline as far as what Social Security deems a disability, and they've reported everything about the household that is necessary. The job of the state is to approve your eligibility. And once you're eligible, the coverage is then handed over to a carrier. So there are 5 carriers in Lancaster County. That's different from from county to county. But in general, when you're considering Highmark, Geisinger, UPMC, carriers that are a household name, generally speaking, the pediatrician that your child would go to has a contract with one or multiple carriers. And the benefit is not only the cost savings, but what I did with this sheet is I basically grayed out the things that aren't as important and put a green bar as to things that can actually help you as a parent. So in here, you'll see that in addition to just having access to healthcare, there are programs in here that relate to a 24 access care line if your child wakes up in the middle of the night and is freaking out and you don't know what to do. Teledoc, which is everywhere at this point, but it really is a useful tool, especially for a parent that is trying to juggle a lot of different things and can't sit 4 hours in an ER setting, or their kid won't reasonably sit still and be okay in that setting. A lot of the programs out there relate to having food benefits and having access to member rewards programs. Today, what we're seeing a lot more of within medical assistance, which your child being in that program due to a disability gives them access to the same programs that people that are low income get. What we're seeing a lot in medical assistance programs is that the word that they use quite a bit is what's known as social determinants of health, which basically says even if you get the right treatment and even if you're taking all your medications and your prescriber is on top of everything, even if everything within your healthcare setting is perfect, studies show that people at the end of the day, their health is tied to so much more than just going to the doctor. It's the diabetes patient that can't afford the orthotic shoes and unfortunately loses a toe or a foot because they don't have the care they need outside of the health setting. It's the people with food scarcity or being held back in education or access to resources. Medicaid has at least for the last 3 or 4 years been focused on adding programs to round out what is happening within the clinician setting, because we absolutely understand that 0 premium and $1 copays help with taking barriers down to get the treatment you need. But there's so much more within each of these plans that really allow you to get access to the resources beyond healthcare that will ultimately impact your child. So coordinating with other coverage, I do want to reference this a little bit, whether the parents have TRICARE through the military, or they have employer-based coverage, or Medicare, or Penny, or what have you. It's always good to impart that on the coverage side, that there's some coordination that has to be made. What we do look at as far as this being a Medicaid program is that it is federal funds and state-based funds used to pay for treatment. At the end of the day, the government will always say that when federal funds, state funds are used, they are the payer of last resort. So in this case, you could have both employer-based coverage with, let's say it's a household of 5, and naturally you're going to have coverage through work for a family, and the dependent would technically be under that under the purview of being a part of the family. Medicaid would step in, and that benefit would be there as the secondary coverage. So as far as that example is concerned, if your only dependent is the child with a disability that you're trying to get covered, the next slide will show you that maybe Medicaid is as primary is okay, and then you would essentially have coverage for you and your spouse or yourself if you're not married. But there's a premium component to the employer coverage, and then obviously if there's treatment, the way that they coordinate, if we're talking about an ER visit, that's $1,500, and the employer has a $400 copay, Medicaid. So your employer coverage will step in and cover. They're essentially negotiating the $1,500 bill down to the $400 copay. Medicaid then takes it the rest of the way down to a $3 copay in that example. When we're talking about just having Medicaid, you're still netting the $3 copay. So the question is always, if you have coverage where there's more than one child in the household, then naturally you're going to have coverage for the other 2, and it might make sense to keep your dependent on the plan and covered by both, and where one picks up, the other one doesn't, and vice versa. But Medicaid would ultimately bring that final rate down. Eligibility at birth. I think if I go back to the talking point that I made earlier about looking at the Social Security Administration guidelines, they're very specific about either children born underweight or children born under a provision called failure to thrive. So when we're looking at eligibility for low birth weight, the link at the bottom of this slide takes you directly to a full list of ages and birth weights that would qualify as a disability for Medicaid under the PH95. These things are less frequent, but oftentimes much more kind of the start of a much higher life of high medical bills, right? Autism can very quickly be upwards of $400,000 a year in benefits that you're needed for treatment that you're needed ongoing. So we're certainly aware of costs down the road, but starting off out the gate with low birth weight or being flagged as failure to thrive, which essentially is in the 3rd percentile or less, that initial shock is an immediate NICU stay, right? And it's an immediate need for long-term inpatient care until the child is discharged. So again, the link at the bottom here certainly takes you to the SSA guidelines as far as where the failure to thrive would come in. And in this case, the percentile is based on height. It's based on weight in kilograms as well. So they're very specific as to the guidelines that you're eligible for. The next thing I will say, as far as what we were talking about earlier, about extending beyond age 18, is at the point where we're no longer a child under the age of 18, I do want to at least set an assurance that it's not that you, it's not that if your dependent is ineligible for the PH95, that all of a sudden they're ineligible for help. When the child turns 18, the government does create a window where the caseworker is required to actually look at other programs that would be available. I did break this up into phase 1 and phase 2. So phase 1 is 18 to 21 years old. That number, that 21 could be a little bit higher or lower, but the reality is early adulthood, that's the moment where we're moving on from truly a child with special needs to a dependent, is basically an adult dependent with a disability. So one of the things that we're looking at is when they hit 18, they're given kind of a blank state of coverage. That blank state, instead of a PH95, they're moved to a PH00. So it's the same coverage. They can keep their carrier. They can still see who they need to see. But it is a 90-day window where you're then, they're then encouraging you to apply for Social Security disability. So obviously a child who is not applying for Social Security disability, they use the guidelines to determine eligibility. But when you do become an adult, that child is now applying under the record of their parent. So they're submitting an application under the record of their parent. And the good news is within the Medicaid program, they have a dedicated team, which is the disability advocacy program. They have a dedicated team that actually assists parents in applying for and getting approved for SSDI. So keep that in mind. Even now, if the dependent is beyond 18, that resource is available beyond just hiring an attorney to assist dependents in getting access to Medicaid and getting access to SSDI. At that point, when they're deemed eligible for SSDI, then they're given whatever the Medicaid category is that corresponds with their diagnosis. So essentially applying for SSDI, getting involved with the DAP program, and the county assistance office asks you to complete the form to give the disability advocacy program authority to help you, and the employability assessment form that basically goes to the physician that says, you know, whether or not the disability is a total or a partial disability, and what work requirements would be needed if that dependent were to go to work. With those two things, they step in and they assist with the application for SSDI. For so long as the disability advocacy program is working on your case and working with the Social Security working with Social Security Administration to get your approval, if that lasts more than 90 days, you will continue to be covered under that PH95, under the PH00 rather, until you get a decision. So I put that at the bottom as far as it being in bold letters. The source at the bottom of the slide also is the manual that proves by the Department of Health that for so long as you guys are working with a representative from DAP and you're applying and being compliant with what they need, the first 90 days are to get you acclimated to working with DAP and getting set up. And then beyond that, they would continue your coverage until there's a determination. At that point, if they're determined disabled, then you're given the corresponding category code related to that disability for Medicaid. And in addition to that, if for some reason there's a delay or decline or anything like that, then it would be based upon income, and then we're not applying under the guise of being categorically needy under a disability, and we would be looking at financially needy because obviously they wouldn't have income at that point. So either way, when turning 18, there's certainly programs in place. Now beyond that initial period of applying for disability income and getting recategorized, the next phase at that point we're talking about is if you are if your child is a dependent that is deemed totally disabled, there's a 2-year waiting period unless the disability is associated with end-stage renal failure. There's a 2-year period from when they're eligible under Medicaid alone as an adult, and when they're eligible for Medicare. And that it adds another layer to it, but it's kind of similar to what I had explained earlier with the employer. The Medicare coverage would step in as the primary, and the Medicaid coverage would step in as the secondary payer to kind of fill in the gaps of Medicare. Partial disability, there's a program in the state of Pennsylvania for workers with disabilities called MAUD. So if your child is able to, let's say, do limited work where they have some money coming home, they're getting some support from SSDI, they would certainly be eligible to apply for MAUD, which again is just another category within Medicaid. The last one I added is there are times where the adult child outlives a parent that either becomes disabled themselves late in life or passes away, unfortunately. And there are additional benefits for that child to basically get grandfathered into coverage. So keep that in mind if you are trying to do any type of estate planning in the future, and you're trying to just make sure that that dependent is going to have access to coverage. The Title II benefit is going to be the program that continues to make them eligible. Title II requires that they were disabled prior to age 22. So again, if we're talking about children with disabilities, that would certainly be topical. Now, I did want to throw in a number of resources here. The Pennsylvania Department of Health does not make it easy to find their rule books. So I threw that link here. But again, it's much like the Social Security Administration handbook, where if you can go in and you can read, generally speaking, that is the black and white manual that they have to use to determine your eligibility. I can't tell you how many times we have gone back to a caseworker and said, well, under 326.1, it says in black and white right here that you should be covering a family member, and then they usually come around pretty quickly. One thing that I was talking to Maureen about before we got on the phone, before we started today, is that oftentimes we don't know what nonprofit resources are out there in the world. So the second one, findhelp.org, if you plug in your zip code to that website, no matter where you are in the country, that Find Help is a nonprofit that aggregates nonprofits. So it's a tool that you can use at any point in time that will give you every nonprofit in the area sorted by type. So it could be a nonprofit that's focused on transportation or legal support or housing assistance or food. That's always one that I recommend having in the back pocket. And then I'll skip over to the last one, Medline Plus. I know there was a push a number of years ago about Medline, but unlike WMD or any other WebMD or any other website, Medline Plus is a .gov that aggregates by health condition. So whatever your child has, as far as a disability, whatever they're dealing with internally, you can basically put that condition in on Medline and find all of the resources from the CDC and the American Academy of Pediatrics and all the first world sources about that condition and how to deal with it. So beyond that, I do have this question slide that actually has my email on it, so you don't have to ask Maureen. I do want to address one more elephant in the room, and that elephant is that since March of 2020 to March 31st of 2023, just about a month away, in the event your renewal came in for Medicaid, because it's usually an annual basis that you have to submit. In the event you receive that packet and the person was ineligible for Medicaid, and that could have been financially, that could have been due to a piece of paper not applied properly, that could have been for no longer being eligible, just you don't fit within the parameters. There was a public health emergency waiver that required states to keep people on plan until the end of the public health emergency. That is ending March 31st. Now, I wanted to add this because in some cases, people going back to March of 2019 would have had their renewal March of 2020 and may have not talked to any caseworker or anyone in the last 4 years. So the next month is going to be, it's going to be imperative that you make sure your information is updated in Compass or updated with the county, because what is actually going to transpire out of those 3 million people is that status quo. We know people are going to stay in that are eligible, and that is fine. But if we consider going back down to pre-pandemic numbers, that means 2 million of the 3 million people are about to go somewhere. They could go to an employer plan, they could go to Penny, they could go to Medicare if they're old enough. But the government has been preparing for this for over a year and a half. I was actually in DC last Wednesday, meeting with CMS, meeting with the government on their plan for this. So they had brought up, this is an all government on hands on deck. It's not an all compass hands on deck. It's all branches. They're looking at this from every side, everywhere. The way that it's going to work in Pennsylvania is that it starts in April, and they will review people that in April of 2022, that was their renewal, and now they're coming up for April of 2023. And then in May, they'll work on May, June, they'll work on June, July, they'll work on July. So at the end of the day, to get ahead of that, if your child already has medical assistance, I would highly recommend just making sure that everything's right in Compass, especially contact information, email, phone number, address, because the last thing anyone wants is if for the last 4 years someone's been automatically renewing and they're like, I haven't heard anything, no news is good news, it's renewing. If it's because you've moved or you've changed phone numbers or there's been any type of lifestyle change, what will happen is that letter will get mailed to the wrong place or emailed to the wrong account and gone unnoticed until you walk into a doctor's office and they say your card doesn't work anymore. So proactively, I suggest going in and updating the system. Reactively, if your child needs the care because they're eligible and they have an issue, then they're going to need the care and most likely continue in the category they're in. But certainly don't ignore any of the upcoming letters. You could be in April, you could be in March of 2024 at this point. We don't know, obviously, when the renewals come, but you're going to want to get ahead of that. So otherwise, Maureen, if you want to
Joshua,
stop
can you go back to the resources screen, and I will stop recording.